Alrighty, Dr. Hotchkiss. So this is a big one that I think a lot of people have questions on. Should you be adding in an estrogen blocker or an otherwise known as an aromatase inhibitor with your TRT, or if you are taking anything more than TRT?
Yeah, so I think that's a good distinction too, right off the bat. Like, is this just TRT, which is going to be bringing you into normal physiologic testosterone ranges, or are you using massively wild, exogenous, super physiologic levels, like quote unquote steroid use? Because those are two different games, and I'll try to answer them both. When it comes to TRT, I would say most people probably do not need one. And I think it's one of the bigger mistakes a lot of people in the space have done historically. I think people just had it in their mind that testosterone good, estrogen bad when it comes to men, and that is way too simple. And I don't think that's true at all. And a lot of times, I think that a lot of the benefit that we get from testosterone is actually from the increase in estrogen. We see guys who have crushed estradiol levels, and when we bring those up, they feel way better. This is evident in things like when you use selective estrogen receptor modulators like Clomid or enclomiphene, which will boost the testosterone, but they're having that impact on the estrogen receptor. They're blocking estrogen receptors. And sometimes guys feel like crap, even though their level says 800 testosterone. It doesn't feel the same to them always as maybe an 800 of testosterone does without that blocking of the estrogen. Now, that's not everybody. Those medications work great for some people. And for younger guys, that's usually maybe a better answer, which we can get into another time. But when it comes to NAI, I don't think you need to just blindly throw one in prophylactically out the get-go. We know now that there are better ways of modulating and reducing estrogen. One of those is increased frequency of your injection. So instead of one large bolus once a week, or sometimes sadly even once every 2 weeks, I've even had clients come to me saying their doctor put them on once a month, which leads to a huge spike in testosterone, which suppresses SHBG and increases wildly your free testosterone, which allows it to be aromatized and increases your aromatization as well, which is higher estrogen. And so instead of doing that large bolus, we can do more frequent injections, say maybe 3 times a week, like a Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, something like that, and reduce the aromatization that way. Guys will feel a lot better that way. They'll have much more stable levels, and the estrogen won't spike the way, like your free testosterone, because those aren't spiking together. So I would say start there. Start with just increasing your frequency, potentially even lowering the dose. Some people are taking way too much. And so that's probably for like 98% of guys, that's okay. Now, there are some individuals that have higher levels of aromatase, the enzyme that converts testosterone into estrogen. They're very sensitive to that. They can develop things like gynecomastia, which is the growth of breast tissue. So if you're getting, achy, sore, swollen nipples, maybe talk to your doctor about adding in some type of aromatase inhibitor. Nowadays, I think people have gone the opposite, and we're like, no AI ever. And we get into these dogmas. I would say it's case by case. Most people probably don't. Some do when you're on TRT. So I'll just put that out there. Now, when it comes to bodybuilding, I would kind of say the same. I don't think that you need one off the bat. And I think that people forget how hypertrophic and that estrogen can be. So it can aid in strength and it can aid in hypertrophy. And so bodybuilders and powerlifters have known for years that they perform a little bit better when they have higher levels of estrogen. When they lower their estrogen significantly is usually pre-contest, and most guys feel like absolute crap. Their estrogen is low, even though their androgens are sky high. Estrogen's low and they feel awful. They have no libido, their strength plummets, and they're only doing it for the look, and that's totally okay, and that's what's needed for that sport at that time. But just running an AI off the bat and being year-round crushing estrogen is not good. Also, as we talked about in previous podcasts, the estrogen is neuroprotective, where the androgens are kind of neurotoxic. And so the estrogen may be able to prevent some neurodegeneration. It's cardioprotective. And so it may be preventing some of the damage that the high androgens are doing. It can be libido protective. And so having high levels of estrogen can actually promote better libido. So I wouldn't just kind of blindly lower it, with an AI when you're doing high cycles. And another thing too is you may want to reconsider how much testosterone you're using. So what I've kind of liked for guys who are doing more of the steroid cycles is use testosterone up into a point where you start to develop estrogenic side effects. For some people, that's only 200 milligrams of testosterone. Others may be able to get away with like 400 milligrams of testosterone before they start experiencing estrogenic side effects. At that point, your testosterone's probably gone too far. Stop there. Add in other compounds like DHT derivatives. At that point, you can add those in. So it doesn't always have to be insane, testosterone, like being, some people used to run like a gram of testosterone and then you're side effect prone. Maybe reconsider running a lower dose of testosterone and then using lower doses of other things on there too, so that you're not hitting one hammer too hard. So that would be my kind of long answer there is I don't think it's blindly needed. Correlate it with your symptoms, with your lab work, and with your physician before just blindly throwing one in.
Awesome. And then one last question. Any just over-the-counter supplements that you could maybe look at that help with either just estrogen metabolism or anything like that? I know some people will throw in DIM with their TRT just to help with that metabolism. Is that something you believe in or feels necessary?
Yeah, there are the two. There's calcium deglucarate and DIM, like you mentioned. Both of those can be good. Again, I would look at those as don't just kind of blindly add those in. You may not actually even need them. I would really push people to reconsider their beliefs about estrogen and stop demonizing it. I have always looked at it as being miraculous and wonderful, and I've loved it. Having my estrogen higher has always made me feel better. That tweak in your thinking will probably change things. So I've never needed to use a calcium deglucarate or a DIM or anything like that. But it could be a good first step before having to use an aromatase inhibitor. So you're definitely right there. But again, I wouldn't add it in unless you're really symptomatic more than anything else. And I still wouldn't add it in without the approval of your physician, because even though it's an over-the-counter supplement, they can have negative ramifications downline. So in some instances, maybe an AR is better for you than some of these supplements that aren't regulated.
Absolutely. Absolutely. No, great insight. And I think something that guys forget too sometimes is just how strong some of the aromatase inhibitors are. And I think dosing is probably kind of the biggest issue that I've seen is, even if maybe you are someone who's that 2% we were talking about that you need it, you probably don't need a milligram of anastrozole. That's pretty high. These were developed for females as in kind of breast cancer treatment drugs. So for men, milligram per milligram, they're very potent. So you really have to kind of fine tune your dosing as well to make sure that when you are taking it, you're not crushing it, and then having to wait for a few days for it to come back up to a range to where you feel better.
Right. And that's where the beauty of lab work comes in. Historically, guys will just take an AI or something and say, oh, I look leaner, I'm drier, that's good, but maybe not. Maybe it's too low. And maybe that's going to cause other downstream ramifications. And you can have rebound estrogen and everything like that too. So, get with a company like we're with, like Merrick Health, that will order in-depth lab work and can work with you to add things in when needed.